So hello everyone, welcome and thank you very much for joining us today. We're discussing a topic that continues to generate interest amongst nutritional professionals, live blood analysis and its role in nutritional practice. So joining us today is Dr. Okker from Neogenesis Systems and Live Blood Online. Dr. Okker is the tutor at Live Blood Online and Neogenesis Systems, and he has over 20 years experience teaching and practicing live blood analysis. He has also overcome the issue of engagement and gaining compliance from his patients and clients. So let's ask him a few questions. So hello, Dr. Okker.
Hi, Elizabeth. Good to be here.
Hi. So let's start with the basics. What exactly is live blood analysis?
All right. Well, live blood analysis it involves observing a fresh capillary blood sample under a microscope and then displaying the image on a monitor so that both the practitioner and the client can see on the monitor what's actually going on in the blood. Now, in addition to providing practitioners with real-time information about a client's nutritional status and priorities at the cellular level, it is also used as an educational tool. It allows practitioners to discuss lifestyle factors, nutritional habits, hydration, stress, and general wellness within the context of a broader nutritional assessment.
Okay, many nutritionists already use questionnaires, food diaries, and laboratory reports. So why would they consider adding live blood analysis?
Well, Elizabeth, one of the biggest challenges in nutritional practice is actually helping clients to properly understand why change is necessary in the first place. So most practitioners have experienced situations where clients hear recommendations, but they then struggle to connect emotionally with the information. Now, live data analysis introduces a visual component. Instead of discussing concepts abstractly, clients can observe their blood sample on the screen and then participate in the discussion. Now, when clients can actually see something rather than just hearing about it, the consultation immediately becomes more engaging and memorable. Now, people are visual learners. The microscope helps to create a powerful opportunity for education and discussion.
Okay, so can you explain how this affects client engagement?
Absolutely, yes. And it makes a huge difference in client engagement. Engagement is, of course, one of the strongest benefits of incorporating live blood analysis into a nutritional consultation. Now, many clients come into an appointment expecting a traditional conversation. When they're invited to actually view their own blood under the microscope, their curiosity increases immediately. Now, instead of being a passive recipient of information, they then become active participants in the consultation. They then, as a result of this, start asking questions. They want to understand what they're actually seeing, and they also become much more invested in the process. This shift from passive listening to active participation significantly improves the overall consultation experience.
So they get to see their own blood cells on a screen, is that right?
Absolutely, and that's really where a lot of the benefits come from, is that actual visual impact of seeing your own blood.
Wonderful. So how does this translate into better compliance with nutritional recommendations?
Well, compliance is often probably the greatest challenge in the nutritional practice. A client may fully understand a recommendation intellectually, but they would still struggle to actually implement it. Now, when clients have had a highly visual and interactive consultation, they often then develop a stronger sense of ownership over the process. The recommendations no longer feel generic. Instead, they become personalized. The client actually feels that the consultation was specifically about them. And this increased personal connection really helps to strengthen motivation and encourage greater adherence to dietary and lifestyle recommendations.
Okay, there've actually been a number of studies, haven't there, that's shown how strong visual evidence motivates this change in human behavior. It's the same concept with what we see in live blood analysis, isn't it?
Absolutely, that's 100% correct. And, there have really been many studies over the years that have proven this, from people receiving images of their actual damaged arteries and then becoming more compliant with their lifestyle changes as a result, to microbial demonstrations, where swab samples from the environment are cultured in petri dishes to help motivate better hygiene practice. Now, this is basically just science proving the principle of seeing is believing.
So do you find that clients become more committed to follow-up appointments as well?
Yes, 100%. One of the unique aspects of live blood analysis is that clients frequently become interested in actually tracking progress over time. So they want to see how lifestyle changes, dietary improvements, hydration habits, stress management, and other nutritional interventions have all influenced what they've observed in their blood. They want to see how those actually change then in the follow-up visit. This creates a natural framework then for ongoing engagement with the client and for ongoing accountability as well. Clients become active participants then in their wellness journey rather than receiving advice and then disappearing until the next problem arises. Now, this actual change in mindset where clients realize that they are the main person responsible for their health is one of the most important shifts that people can make to become more proactive about their health.
Wow, and I imagine that this has quite an impact on the practitioner-client relationship, yes?
It really does. Yeah, the consultation becomes much more collaborative as a result. So rather than the practitioner acting sort of solely as an expert, delivering recommendations, the practitioner becomes more of a guide, helping clients understand what they're observing and how lifestyle choices that they're making may be influencing their overall wellness. So clients often feel more heard, more involved, and more empowered as a result of this. And this collaborative environment that it creates really helps to strengthen trust and improves long-term client retention in practice.
Yes, many nutritionists are looking for ways to differentiate their practice. Does live blood analysis help in that regard?
It certainly does. Yes, the nutritional professional, excuse me, the nutritional profession is becoming increasingly competitive. Clients have access to countless sources of information online. Many practices are actually offering similar services. So live blood analysis helps to create a unique and memorable experience for clients. When this is used professionally and ethically, it provides something that many clients have really never experienced before. And this helps them to distinguish the practice while reinforcing its educational and wellness focused approach.
Okay, so what kinds of conversations does live blood analysis help facilitate?
Well, it really just helps to make all these abstract concepts about health and wellness a lot more concrete and a lot more easier for people to understand. Things just fall into place better when they actually can see what's going on in their blood. So it can be a very useful starting point, looking at the blood in a consultation for discussions around things like hydration habits, dietary quality, lifestyle patterns, stress management, sleep quality, exercise habits, and also nutritional support, nutritional supplements, and so on as well. The microscope image often serves as a sort of a visual anchor that helps clients better understand broader and often abstract wellness concepts a lot better. And the data drawn from the image is is very valuable to the practitioner, the information that they get from there, to help them better understand their client's nutritional needs. But the conversation that the image facilitates is often then where the value lies for the client.
And do nutritional deficiencies show up in live blood analysis?
Yes, yes, 100%. There are various nutritional deficiencies that we can pick up with live blood analysis. There are many anomalies in live blood and dry blood images that relate to specific nutritional deficiencies. And more important, often in practice than just deficiencies, is to understand why those deficiencies are there. So in many cases, challenges actually are more due to what the body is able to absorb than what the body is able to, to assimilate as a result from the diet. So the diet might be good, but because there are certain shortcomings in terms of digestion and absorption, the diet doesn't help as much as it really should. And live blood analysis is extremely helpful to, pinpoint and detect those specific imbalances.
So it can pinpoint and detect those imbalances. That's very helpful, very useful.
Very useful, and then one can obviously monitor those changes over time, during the course of treatment, which also helps to show the practitioner that the client is on the right track, and it shows the client that things are improving, so it helps to keep them motivated and encouraged.
That must be very motivating for the clients.
Absolutely. It really just creates such a different dynamic in practice when you have access to this because of that visual impact. There's immediate buy-in, and people are immediately interested to find out, what they can do to actually address what was detected in their blood.
And are there any ethical or professional considerations that practitioners should keep in mind?
Yes, yes, absolutely. This is extremely important. There are some really important considerations here. Practitioners should work within their scope of practice and, of course, comply with local regulations. Live blood analysis should not be offered as any type of medical diagnostic test. Claims about diagnosing specific diseases or medical conditions or replacing conventional pathology testing should, of course, be avoided. Where appropriate, clients should also be referred for conventional investigations and laboratory testing where needed. And it is crucial also for practitioners to actually understand exactly how live blood analysis can and should be used. And this, of course, then benefits both the client and the practitioner.
So this is why proper professional training is so important then, yes?
Absolutely, it really is. We can't really stress that enough. Although live blood analysis is minimally invasive, we only really take a little drop of blood from the finger. It's a pinprick type of test. There are risks to the client and to the practitioner. Now, we cover these in detail in our training course to ensure that practitioners how to use live blood analysis responsibly and to its full potential as well.
Great. So if a nutritionist is considering adding live blood analysis to their practice, what would you say is the biggest benefit?
Well, there really are so many different benefits from live blood analysis, but if I had to summarize it in one sentence, I would say that live blood analysis transforms a consultation from a discussion into an experience.
Okay.
And one of the greatest strengths, really, I would say, is its ability to increase engagement in practice. When clients are engaged, they pay more attention. When they pay more attention, they understand more. And when they understand more, they're also much more likely to then take action. Ultimately, better engagement often leads to better compliance and stronger long-term relationships with clients.
Yeah, and probably much better results as well, yes, because people are following the protocols.
Yeah, it's twofold. The practitioner is able to make better decisions regarding interventions for each individual case based on what they're seeing on the blood. So they're a lot more accurate with the assessments, and clients are a lot more compliant. So, there's a huge benefit in the results that we see in practice.
Okay, so before we conclude, do you have any final thoughts for our audience?
Well, yes, I think there's one thing I can add, Elizabeth, is that in today's healthcare environment, education and engagement are more important than ever before. Clients are looking for experiences that help them understand their health in a meaningful and personal way. So when used responsibly and professionally, live blood analysis can become a valuable tool for communication, motivation, and client empowerment in practice. It helps to bridge the gap between information and action, and that can make a significant difference in helping clients achieve their wellness goals.
Okay, well, thank you very much for that. So, if you've been watching this and you think that live blood analysis could help your clients understand their health more clearly, improve engagement, encourage better compliance, and add a valuable new revenue stream to your practice, then we'd like to invite you to look at live blood analysis training. This is a 12-week practitioner training course designed to help you learn live blood analysis in a structured, professional, and well-supported way. We'll send you the recording of this meeting together with information and course enrollment details, and also how to get in contact with us if you have any questions or if you'd like to learn more. And if you'd like to find out how to add live blood analysis to your practice, please click on the link that we send after this meeting or reply to the email, and we'll be happy to help you take the next step. So we hope you found this helpful. Thank you for joining us, and we look forward to seeing you on a training course soon. So thank you very much, Dr. Okker.
Thanks very much.
Thank you and goodbye.
Bye bye. Bye bye.